Hello, this is Dr. Gay from First Look MRI, and this is a 34-year-old male who was hit by a car. He's got bad low back pain and pain shooting down both legs. And in this view, we see him in profile. This is the lumbar spine. Here's L1, 2, 3, 4, 5. So here's the lowest lumbar vertebral body. This is the sacrum here. We can see the squares of the hard bones, vertebral bodies. In between, we have these soft discs. These are the shock absorbers or the cushions that keep the bones from rubbing together. And this patient just has a classic, nice example of a disc herniation. And we can see here a normal disc, a nice cushion. These squares, these bones are nice and normal appearing. And the disc material looks bright, which is normal. And behind the vertebral body, we see an area of brightness. This is fluid in the spinal canal. So we should see the bony column here. Behind it we see fluid in the spinal canal and also some nerves. And then back here we see these spinous processes. These are bones in back. So bone in front, bone in back, and the fluid-filled spinal canal and the nerves. Now we're going to find that disc herniation. So this looks great. Nice disc. Nice disc. This disc is not as nice. We see a little white thing along the back. This is what we call an annular fissure or an annular tear. And the annulus fibrosus holds the disc material in, so the annulus goes around the front, sides, and back, and it can have a little rent or tear, and when it does, it becomes bright. That can cause a lot of pain. We can see the spinal canal filled with the white fluid. There's still plenty of room if we put up this image right through it. We can see this little area here, that's that little protrusion with annular fissure. If we go up to a higher level like this is going to be completely normal. This is the spinal canal. Looks ovoid. We see nerves in the back of it here. And then here's the front, back. So we see these little dots. See, these are the nerves in the back. And all the white stuff is fluid. So this is what we want to see, a nice wide open ovoid spinal canal. If we go down to this level, we see small disc protrusion here. This is the corresponding image. Now we're going to go down to the problem. This is a disc herniation. Right here is this disc material that spilled out backwards into the spinal canal. We note here we can see fluid in the canal, but we get here we don't see the fluid at all. It looks like the disc herniation is completely filling the spinal canal, causing a severe stenosis. So we're going to go down and look at this in the short axis axial image, and sure enough, this dark glob is a big disc herniation, just soft disc material that completely fills the spinal canal and causes their symptoms. So this is, for comparison, up high here, we see a big wide open spinal canal filled with nerves, filled with white fluid. And at the level of the disc herniation we see no fluid. This disc herniation is completely filling the canal. So a nice example of a soft disc herniation causing severe central canal stenosis at this disc level L4-5, and another abnormality up here that can cause back pain called a small central protrusion with annular fissure. Thank you very much.